Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. Glad to be back here. I'm sorry about my technical problems last week, but we're here now, and hopefully we can get through a lot of your questions. For those of you that are coming back again, welcome back. It's good to see a number of familiar names on my message board. And for those of you that are new, welcome here. There's a couple ways you can participate tonight. One of those is to actually write a question to me. Go bold, especially if this is your first time. And the way you do that is over on the right-hand side of the screen at the bottom, there is a chat box that you can write your question to me. As you write that question, I ask that you don't hit the enter key until the whole thing is done. So write one big, long, run-on paragraph if you need to. Well, actually, shorter paragraph because long questions are hard to answer here. But that way I get the whole question. If you try hitting the enter key while you're writing it, then I get small snippets here and there, and it gets really hard to follow on my side of the screen. The other way you participate is listen to the questions as I read them or as you see them on your screen. Those of you that are live here, you actually get to see them on your screen. The recorded version, they don't show up. And you'll see the answers I give. There's a lot of good learning that takes place that way. And I can sometimes get a bit winded, long-winded on my responses, but usually for a good reason. I'm trying to explain things, hopefully in a way that makes it easier for you to understand what's going on. So as usual, I am creating a recording of tonight's webinar, and we'll be getting that out to you tomorrow morning. So watch for that. Somewhere around 9:30 a.m. Pacific Standard Time is my drop dead time to get it out. Usually I'm able to get it out before those times. If not, look for it later in the day. But my goal is to have that for you tomorrow morning. And then also in tomorrow morning's email, you'll be able to sign up for the last webinar of this month, which will be next Wednesday. So we'll be with you here again next Wednesday night as well, too. All right. So without any further ado, let's go ahead and jump in here. All right. So this first question is from James. Hi, James. Hi, Dr. Ross. Thank you for everything you do for the Lyme community. You're welcome. See, I've been off antibiotics for Lyme and Bartonella for 2 years, doxy, rifampin for a year, as I couldn't tolerate it anymore. I have been in the Herbal protocol on your site since 2021, but when I stop them, the tingling and the head brain fog start coming back within a day or two. Is this a sign of persistent Bartonella? I'm currently on Banderol Cemento, oregano oil, Hutania, Sida acuta, and Cryptolepis. Should I be adding or doing anything different to get a break through here in this treatment? Mainly neurologic symptoms. Also, can you take LDN and lumbrokinase with losartan for blood pressure? Okay, so I'll answer. The last part's the easier part. So yes, you can take low-dose naltrexone, which is LDN, and lumbrokinase with losartan. Your blood pressure medicine, losartan. Those are okay to do, okay? So everyone, just quickly, lumbrokinase is an enzyme that's made by earthworms. It's a crazy illness. We use some crazy things sometimes to help people with it. But the reason we use enzymes from earthworms is to break up what are known as fibrin nest that can occur in the infection Babesia and in the infection Bartonella. And what fibrin is a blood clotting protein that can mix together with your germs, your Bartonella and your Babesia, and they kind of weave themselves into the germs, and they form these nests that attach themselves to your blood vessel walls, and it becomes really difficult to get your antibiotics or immune system in there. So lumbrokinase is something I'm having people in my Bartonella and Babesia treatments add somewhere around 2 months in or so to help move the treatment forward. So yes, you can do that. Low-dose naltrexone. Oh, one other thing lumbrokinase does is it helps break down a sugar slime layer that covers germs called a biofilm. So it breaks down biofilms as well, too. Okay. And then low-dose naltrexone is naltrexone. At full dose is something we use for people with narcotic overdose. It's a narcotic receptor blocker. We have a set of natural narcotic receptors in this called our endorphin receptors, and we make these chemicals called endorphins. That's Mr. Thor back there, whoever wants to know who that is. That's one of my Basenjis. He's come out to visit us, it looks like. But anyhow, we have these, our body makes endorphins to regulate pain, but endorphins also regulate your immune system. And if you provide a temporary blockade of about 4 to 6 hours of your endorphin receptors, it has a way of resetting your immune system so that it can better fight infections, and so it is less inflammatory, less autoimmune inflammatory. Okay, and so. And the reason we call it low dose is it's manufactured a 50 milligram pill. When we use it as LDN, we use it at we work up to about a 4.5 milligram pill. Okay. So if you're interested more about these, at my website, I have a whole article on low dose naltrexone, and I have an article on lumbrokinase. So you can read them there. And I may even show you those to you here in a few minutes. All right. But that's what those questions were about. All right. So James, it'd be interesting for me to answer your question. It would be interesting for me to ask you a number of questions to find out what additional symptoms you have that come back when you come off the herbal antibiotics, okay? So I would want to know, for instance, do you have some symptoms other than neuropathy that suggest Bartonella is getting active? All right. So other symptoms that can suggest Bartonella is getting active can be pain on the soles of your feet, some air hunger, if you can't get enough air from time to time. That also could be a Babesia symptom, but it's seen in Bartonella too. Having increased anxiety or depression sometimes can be part of Bartonella. Having a sense that you have a lot of buzzing or vibrating sessions deep within you, not visible, but something that you feel deeply inside, that sometimes could be a suggestion of Bartonella. And any kind of return of neurologic symptoms can sometimes suggest Bartonella, as well as can worsening of your thinking. Okay, so if you had a number of those things getting worse in addition to the neuropathy, I would be wondering if your Bartonella killing herbs are just not getting the job done here. Okay. All right. And because typically when you get, all right, so that's one thought. All right. So Bartonella compared to Lyme, when you stop a treatment and you're not done, or if that treatment's not doing well enough, somewhere within a few weeks, you'll start to have a return of symptoms. Lyme, on the other hand, grows a lot slower. And because it grows slower, it takes longer for its symptoms to return when you stop something too soon, usually about 6 to 8 weeks. Okay, so a quick return of symptoms tends to make you think more of a Bartonella. All right. And then, but the other thing just to be aware of, any of these prescription antibiotics or herbal antibiotics that we use also have anti-inflammatory effects. And so it could be that you're just losing the anti-inflammatory effect here. All right. Now, I can't tell you for sure what to do because I'm not your physician, so I can't I can talk in terms of what I would do in a similar situation, but I can't tell you what to do because I don't have a physician-patient relationship with you. All right. But if I had a patient that had return of neuropathy within days to weeks of stopping herbs that are supposed to be keeping infections under control, and if you had a number of other symptoms suggesting that Bartonella may still be there, I would probably want to retailor the Bartonella herbs that you're on. So in your treatment right now, the Banderol and Cemento you're on are antibiotic herbs that are targeting targeting Lyme. I'll put it that way, okay? The oregano oil that you're on targets the non-growing or hibernating persister forms of Lyme and of Bartonella, and can also treat growing forms of those too. Houttenia and Sitacuta are part of your Bartonella treatment. We think they're probably more target growing Bartonella. And then Cryptolepis is something that you've added in that can actually target both growing and persister Lyme and growing and persister Bartonella. So for Bartonella, your treatment currently is the oregano oil, Houttenia, Sitacuta, and the Cryptolepis. Okay, all right. Now, I've mentioned some terms here, everyone, tonight. Many of you may be familiar, but let me just break this down for a minute. So these things called persisters are what's known as a growth state of the germs, all right? So both Lyme and Bartonella have the ability to be in a growing state and in a hibernator, or we call that persister state. general antibiotic herbs and general antibiotic prescriptions that we have historically used to treat those infections don't do anything for persisters. All right. So these days, many of us, when we build treatments for Lyme and Bartonella, are trying to include things in that can also target the both growing and persister forms of Bartonella. Right. So if in a situation like this, if Bartonella really is getting active, what I would do with a patient of mine with something like this is I would probably take that oregano oil and switch over to stop it. And I would switch over to a cinnamon clove oregano oil. So get a little bit more types of oils that can kill growing and persister Bartonella. Okay, so liposomal cinnamon clove oregano oil capsules. There's a product by Doctor Inspired Formulations called liposomal cinnamon clove and oregano essentials. Okay, and I would have my patient do 1 pill twice a day of that. I might consider getting rid of the cryptolepis and replacing it with Japanese knotweed. Japanese knotweed, like cryptolepis, can also treat persister and growing Bartonella, can treat persister and growing Lyme as well too. And so what I do with Japanese knotweed is I tend to have people take 30 drops twice a day. Okay. So those are some thoughts for you. Again, you might want to discuss these with a healthcare provider because I don't know all the ins and outs here, but I can't ask you all those extra questions that I would want to. Okay. But those are some thoughts for you too. Okay. All right. Good luck, James. All right. Let me do a quick screen share here. Hold on a minute. This one was not. Bear with me here a minute. We are going to get this to work tonight. Let's try that again. Huh. What happened there? Oh, there we go. All right. It took a little doing. Anyhow, this is my Lyme disease information site, Treat Lyme by Marty Ross MD. In terms of finding that article on low-dose naltrexone, you could write LDN in my search bar up here, or you could find it in my immune system chapter here. And then this is my article, low-dose naltrexone in Lyme. Okay, so you can get more information about low-dose naltrexone. And then in terms of just if you're looking for information about these things called persisters, take a look in my infection treatment plans chapter and take a look at this article called How to Treat Persister Lyme and Bartonella, where I lay out the various herbal options that you have to treat both kinds of persister Lyme and Bartonella. Okay. All right. All right. Good luck to you. Hello, Dave. Let's see. Hello, Dr. Ross, and thank you for these amazing webinars. You're welcome. I've been on well call for 6 months for mold toxicity, and yesterday my Quest labs came back with an elevated ALT of 53 and AST of 32. ALT is elevated, and I'm trying to figure out why. My ALT, AST have begun slowly elevating. In October, they were 35 and 29. Can well call cause elevated liver enzymes? I did have wine 5 days prior to my labs being drawn, so I doubt that is causing the issue. I have read well call can elevate your triglycerides, at which point high triglycerides can then elevate your ALT. Any thoughts, perspective on why my ALT would elevate would be extremely appreciated. My mold doctor is out sick with COVID. Thank you. So first of all, ALT and AST, everyone, are is something in your blood, and they're enzymes actually that come from the liver. And if they're elevated, it means there's liver inflammation. Depending on the laboratory that does the lab, the range of what is considered normal varies by lab. Okay, but generally for both of these, a lab will report somewhere between 20 and 40 or 20 and 45 is the normal range for these labs, okay, generally, all right. But again, you have to look at the actual lab that conducted it. They'll tell you what their normal range is. It'll be from something to something, okay? So when I have somebody in treatment for Lyme and they're on herbal antibiotics and other things that might lead to liver enzyme elevation, I am okay as long as we can keep those liver numbers within 2 times the upper end of normal. All right. So for instance, if an ALT normal range in your lab is 20 to 40, the upper end of normal is 40, I would accept it going all the way up to 80. Okay. So these are what you're laying out here are, if they are elevated, and I'm not even sure they're elevated, I know they're going up, but if they're still in normal range, there isn't anything to worry about. And if they're still within 2 times the upper end of normal range, there isn't anything to worry about. Now, I guess in theory, well-call could cause elevation, but you would need to have some pretty high triglyceride levels. And so you might want to get that looked at. The other thing, you haven't told me anything about any other herbs or supplements that you're on. So it may have nothing to do with well-call. It could be that you've got something else triggering your liver to become slightly inflamed. Okay, and that could be herbal antibiotics, could be prescription antibiotics, could be other supplements that you're using. And I can't tell again because I don't know what your list is here. Okay, but I would consider looking at is it something else in your medications that might be medications? I mean herbal and prescription medications that could be doing this to you. Okay, and then finally, liver enzymes can become elevated because of alcohol, but you're not. I mean, if you drank over a week before that, that's not going to probably be doing that. And then let's see, rarely, with Lyme. All right. So other causes of enzyme elevation can be infection. All right. And we typically think of infections called hepatitis A, hepatitis B, hepatitis C. These are viral infections. Epstein-Barr virus, sometimes when it is an acute phase, can give you elevated liver enzymes. All right. And, but one of the rarer things I see sometimes is that Lyme can lead to Lyme infection. The Lyme germ infection can sometimes trigger elevated liver enzymes as well too. And so, for instance, I've had people that came in to see me, had really high liver enzymes, like 100 to 200 range. And we did all the testing to see if there was an infectious cause of this, and all their tests came back negative. And knowing that they had Lyme, I've just gone ahead and used the antibiotics anyhow. I kind of ignored those high liver numbers and put them on antibiotics, and being on antibiotics resolved their high liver numbers. So I think that Lyme in some people can give a hepatitis as well too. Okay. All right. Good luck to you, Dave. Oh, Dave, one other thing, in terms of if your liver numbers are going up and is a result of medications or supplements, you can actually support your liver to handle those better. And what I like to use for that is either a supplement called N-acetylcysteine. N-acetylcysteine is a building block for the detox enzyme that supports your liver called glutathione. Okay. Or you could take liposomal glutathione. Liposomal glutathione is glutathione that's microscopically wrapped in fat to increase its absorption. And when you microscopically wrap in fat, you have increased absorption. There's a product by Research Nutritionals called Trifortify, and that product has got good research behind it showing that you actually do get good absorption. You get elevated levels of glutathione in the red blood cells, which is what they measured, and likely you're getting it elevated in every cell in the body as well too. Okay, so those are two things that I will put somebody on if I've got elevated liver enzymes to support the liver, I'll do N-acetylcysteine, or I will do glutathione. The glutathione, the Trifortify product from Research Nutritionals, I do a teaspoon a day, and that N-acetylcysteine I do is 500 milligrams 2 times a day. Okay, all right. Good luck. Hello, Brian DOC. Do you see benefit in thymic supplements or glandular type supplements? So, some people give glandulars, like glandular adrenal gland, ground up adrenal gland, ground up thyroid gland. And I work with ground up thyroid. I use something called Armor Thyroid, so I do use that. I think if you have low thyroid, that's can be useful. My way that I prefer to support the adrenal glands is actually to use an Ayurvedic Chinese medicine herb called ashwagandha that's been shown in animal studies to improve thyroid and adrenal function. And that's usually 400 to 500, or will come as a 400, 500 milligram pill. And I have people do 1 to 2 of those in the morning and 1 to 2 of those between 1 and 2 in the afternoon. Okay. I tend not to use other glandulars though, but those would be the main ones that I use in my practice. Okay. And then in terms of thymic supplements, the thymus gland sits here in your chest, and as we get older, it gets smaller and smaller, and eventually, as we get really old, even older than me, it basically just becomes non-existent. But it does release peptides and chemicals that interact with your immune system to both modulate what type of immune cells they make. So more T cells to fight infections, for instance, or B cells to make antibodies. Okay, so it modulates the immune system, but also it releases peptides, for instance, that do a good job of regulating inflammation as well too. These days, my preferred way to work through the thymus gland is actually to use peptides. When using peptide glandulars before, or peptide or thymic supplements that were not peptides, I just didn't find good results, to be quite honest with you. Except for one, there's something called Thymic protein A that I like to use, sold as a product called ProBoost. And I like using it because it seems to acutely turn on the antiviral part of your immune system when you get cold viruses, flu viruses, things like that. And it seems that it can shorten the duration of how long that lasts. So that Thymic protein A is sold as a supplement called ProBoost, and usually for an acute viral infection, I'll have somebody put a packet under their tongue every 2 hours, 3 times on the first day. And then the next day, I'll have them put a packet under their tongue 3 times spread throughout the day. Okay. And that's part of my own regimen of how I manage acute viral infections too. That's how I try to get through them quickly. And it seems to shorten them. That's my impression. There's some limited studies supporting that concept as well too. Okay. But in terms of Lyme infection, the main peptides that I'm working with that regulate the immune system are one that's called a TB4 Frag. That's a peptide made up of 4 amino acids, and it regulates the inflammatory nature of, or it can regulate inflammation. It can help decrease cytokine inflammation. It has some ability to help promote healing of blood vessels and generation of blood vessels as well too, and may help change an immune system that's tipping more towards an autoimmune condition towards one that's better at fighting infections. Okay. The other one that I'm working with these days is a product by Integrative Peptides called Thymogen A1, or Thymogen Alpha 1, I should say. And that product is made up of what are known as bioregulators that work at the genetic level to send signals to your thymus gland to help it work better. what they seem to do is they have a good job of modulating the type of immune cells that are made and the function of those immune cells. So you get a better balance in potentially in the antiviral fighting cells in your body and the Lyme fighting cells in your body as well too. Okay, so both of those products, what I've been doing is, so I tend to think of the Thymogen Alpha 1 as being something that stimulates or balances out, make sure you have the right kind of white blood cells to fight infection. And I tend to think of the TB4 Frag as something that modulates the cytokines that get produced by the immune system so it's less inflamed, and a cytokine picture that makes it so that the immune cells can work better. Okay. All right. So that's how I kind of break it down. Okay. All right. So anyhow, those are products I use, and I'm using one pill twice a day of each of those. Okay. All right. Good luck to you, Brandy. Let me just show you this here. I'll do a screen share here. All right, so everyone, I know peptides people are very interested in peptides these days. So let me just show you what we've got here. So the company that I've been carrying their products for peptides is called Integrated Peptides. And right now that we have in stock from them, this one called BPC 157. Think of BPC 157 as a peptide that comes from the stomach lining that can repair both muscle and nerve injury problems, joint problems, stomach repair, and help stomach and intestinal function. It helps balance out your immune system. It modulates it to a degree. It can help your mitochondria cell energy factories work better, and it may even help with some of the mast cell problems that people get into as well too. So that's kind of your Swiss Army knife, okay? And then CerebroPep is one we do have in, and this is a peptide made in the brain that is made to repair brain trauma, and that can be from literally having your head hit, brain trauma, or it can be from infection trauma, or it can be from stroke trauma. Okay, so that's CerebroPep. And I use one pill twice a day on that. And then his is the TB4 Frag I was just telling you about that can kind of modulate the inflammation, maybe help with tissue genesis. It can even help decrease scarring as well too. There's some science that shows that. And then this one called Thymogen Alpha 1 is the one I was telling you about that modulates the immune system to make the right kind and amount of white blood cells that can help fight infections. Okay. All right. The one that's missing, and I'm really frustrated right now with integrated peptides, is this one called KPV, because this would be good at regulating mast cells and inflammation. And then the other one that I wish they would get going on again here is the Can't Wait. That is useful. It has some properties that related to growth hormone regulation and can help. Actually, I'm sorry, not growth hormone regulation. I'm going to say decreasing appetite and making you feel fuller is kind of what this one would do. Okay. But as many of you know that have been following integrated peptides, they have a supply issue. They have a good product. It works really well. I'm finding good things in my practice using it. But they're having a hard time keeping their supply line up. So I share your frustration with that. But right now I'm supplied really well on the CerebroPep and the BPC 157, that Thymogen Alpha 1, as well as the TB4 Frag. Okay. I be honest with you, I've become so frustrated with their ability to keep things supplied. And I can't figure, I think their product is good, but I can't figure out why they're not managing their supply chain better, whether they need some funding to go out and buy their supplies better, or whether they have a supply chain issue, or whether they're just mismanaged from that standpoint. I can't tell. It has me wondering about possibly getting into the production end myself to try to come up with a better supply of peptides, because I think there's a number of oral peptide products that I'm finding very helpful in my practice, and I want to make sure that there's an adequate supply of that. So anyhow, that's one of my pipe dreams. We'll see if I go in that pathway at all or not. Okay. All right. Anyhow, thanks. All right, let's move on here. Hello, Jim. Hi, Dr. Ross. Thanks again for these great webinars. What vitamin and mineral deficiencies do you most often see in your Lyme and co-infection patients? Also, are red stretch mark rashes only caused by BART, or are there other things that cause these? So the red stretch mark rashes can sometimes just occur. Okay, all of us could be subject to that. But when you see stretch marks that go against the natural skin lines, all right, so skin lines would be the natural way that skin can fold. So for instance, how can I demonstrate this? Okay, so I'll just demonstrate. You probably can see my hand here. So if I squeeze my fingers this way, do you see how the skin lines tend to run that way, across that way? Okay, so I'll do that again. Okay, that's the natural direction of the skin lines. Okay, all right, now if I try squeezing it the other way, do you see I don't quite see all those wrinkles coming in there? Okay, because the skin lines run more that way. All right, so what Bartonella marks tend to do, they tend to go against the skin lines. Okay, they run perpendicular. So you have to look at where you are on the body, try to see which way your skin lines go, and if they're vertical to those skin lines, they're not running the same direction, but the opposite direction, 90-degree direction. That's what Bartonella stretch mark rashes tend to do. Okay, all right. In terms of could something else give those when they go against the skin line? I'm not really sure. I mean, sometimes they rapid weight loss or rapid weight gain can lead to those. And sometimes other causes of stretch mark kind of rashes can be being on steroids could do that. But those would be the main things I would think about. Okay. And then in terms of mineral deficiencies, I think generally we as a society are mostly all deficient in magnesium. Magnesium, because we just don't get enough in our food sources, and your cells need magnesium to run a lot of stuff. Okay, so most of us probably have some general magnesium deficiencies. I'm not really aware of any other specific ones that would pertain to Lyme, though. Okay, all right. Thanks for your question, Jim. Excuse me. Hello, Alex. Let's see. What are you recommending for confirmed COVID infection for us Lyme patients? Paxlovid, any supplements? If so, which ones? And recommend daily dosages. Thank you. Okay. So to this day, for acute COVID, what I'm recommending is a few things. Number one, I want to get the cytokine surge down. I want to control cytokines because the main thing that causes you to get into trouble still with COVID is the immune system overshooting with all of the cytokines that it makes. Okay. So I like getting people on oral glutathione right away. And if I'm using the Tri-Fortify product, I'm going to have people do a teaspoon twice a day. I also like to have people get on curcumin, which is a component of turmeric. It gets inside of white blood cells and can really do a good job of limiting cytokine production. And I would do 500 milligrams 3 times a day on that. I also have patients start quercetin, which is another, it's a bioflavonoid that also can decrease cytokine levels, but also it acts to carry zinc into the inside of the COVID germ, or inside your cells actually. And zinc has the ability may block replication of COVID. So it may keep you from getting as bad of a problem. So I would do a quercetin, probably up to about 500 milligrams 2 or 3 times a day. And I might couple that with some zinc picolinate at 30 milligrams 1 time a day. Okay. Now, so then I would see how that's going. Now, if you're a person that is in a high risk category for having a bad outcome for COVID, then I might consider doing Paxlovid on top of that. Okay. So high risk is over age 65 And also if you have certain conditions that are high immunosuppression issues. So if you're on immunosuppressive agents, if you have diabetes, if you have, I think renal disease is on there. And I have to pull that list out each time and look and see what CDC is saying is high risk. But those people I tend to want to put on Paxlovid. Lyme disease itself is not a condition of immune suppression in terms of getting over COVID. I don't think anyone with Lyme has any worse of a problem dealing with COVID than anyone else does. Okay. So I tend to break it down by what is a high risk group, basically. Okay. And yeah, I would do the Paxlovid. I know there's people out there still are talking about ivermectin, but I just don't. The science to me is building up saying more and more that it probably is not an effective agent. Okay. That's my interpretation of that science. Okay. All right. Good luck to you, Alex. Hello, TJSE. Do any of the standard Lyme infections, Borrelia, Bart, or Babesia, work on the mooncycles, or is that strictly other parasites? I heard someone refer to Borrelia once, not as a bacteria, but as a parasitic protozoa once. We get rashes and extreme fatigue like clockwork 2 to 3 days before a full moon. Took years to find the pattern. It's really interesting. I know from my practice that there are a number of people that their illness cycles with the moon. It just does. And I don't know why. I acknowledge it happens. I don't see that it happens any more frequently with a Bartonella versus a Babesia versus a Lyme infection, but I acknowledge it happens. I don't have an explanation for why it happens, though. Okay, all right. And then in terms of Lyme is not a protozoa or parasitic protozoa. It's a bacteria. And depending on what you mean by parasitic means it thrives in us. It sucks stuff off of us to live. And yeah, you could call it parasitic if you want to, but it's not a protozoa. It's a bacteria. Okay. All right. Thanks for your question, TJ. Hello, Lynn. Let's see. Hi, Dr. Ross. My son sent me a picture of what he fears is a tick bite on the back of his head. He said he found it because it was a little sensitive. I don't see any lesion, scab, or indentation at the center, just a tiny, smooth red bump. Would that rule out a tick bite? He recently sat in the grass in a park in Los Angeles area and about a week ago in the San Francisco Bay Area. If it's uncertain whether it's a tick bite, what would be good to do? Also, would you recommend ATP 360 and glutathione to protect mitochondria before exposure to radioactive dye in a test procedure? Is there anything else you'd recommend either for protection or to help with detox from the radiation dye? So I don't have a specific radiation dye protocol. I just want to let you know that. And I don't know. I haven't been asked that problem before. I don't know. So I'm sorry about that. That one is something I'm not aware of. In terms of the tick bite, so when you get a tick bite, 50% of the time people will get a bullseye rash. That means 50% of the time they don't. Okay. And so it could have been a tick bite, but also other bugs can bite you and leave marks like what you're describing here too. So I can't say whether it is or not. So keep in mind the main reason we get concerned about tick bites is we get concerned about the ticks that carry Lyme. Okay. Now ticks carry other infections like rickettsia, like Ehrlichia, Anaplasma, Babesia, and Bartonella. But those, if you get a tick bite and you start developing symptoms, that's the time to treat for those, okay? Lyme, on the other hand, we want to try to treat for people that get tick bites from the black-legged deer tick. So not all ticks carry Lyme. It's the black-legged deer tick that carries Lyme, all right? And the reason we treat for those tick bites is that we want to prevent somebody from getting Lyme. And there is good science that shows that prophylactically treating with antibiotics in mice, that's where the good science is, that we can limit people from getting Lyme disease, okay? we do not have that science about prophylactically using antibiotics for other type of tick bites that may carry some of these other infections. And the guidance that most of us follow for those is to see if you get symptoms and then treat for that. Okay. So in your son's situation, I probably would just watch and wait and see what happens. There's risk in using antibiotics as well too. And just because he's got a bump from something that bit him does not necessarily mean it's Lyme. Does not necessarily mean it was a deer tick. Okay. All right. Good luck to you, Lynn. So if you're looking for, so I have an article that explains this probably in better detail for you too. So in my, take a look at my acute tick bite tab here, where I do have my article on how do you handle an acute tick bite. And I also discuss when it's appropriate to use antibiotics for tick bite and when it's not appropriate. Okay. And I review why I don't like the CDC and the Infectious Disease Society of America guideline that says you only get, anyhow, just take a look here. You'll see what I mean. Okay. All right. Hello, Barkley. Let's see. How are you treating long COVID? And do you think it is a permanent long-term damage to the immune system? Do you think it's a lifelong infection that just smolders like all the herpes viruses? So, Barkley, what I would say is I don't think we really know. I think there's a lot of people out there with theories, and we have limited science still to guide us, okay? So one of the theories about why people have long COVID is that their monocyte white blood cells are not able to get rid of the spike protein once they attack the spike protein. And these monocytes then stay chronically inflamed, okay? So a proponent of that theory that has some limited research that only he has done, no one else has replicated his research, be careful with that kind of stuff, okay, is a guy named Bruce Patterson, who basically has a cytokine test profile that he does, and he's got some science showing that a certain type of cytokine fingerprint or profile suggests that you're one of those people that your monocytes have not been able to get rid of the spike protein. He's got a protocol using an antiviral HIV medicine coupled with an anti-cholesterol medicine to help those monocytes get rid of those spike proteins. From people I've seen that have done it, it gets mixed results. Some people do get better on it, but not everyone. Okay, so that's one theory. Okay, another theory that can happen is that whether you or not you have this spike protein in you or not, your immune system from having had Lyme gets overturned on and overinflamed and can't turn itself off. Okay, those people. Because of that theory, one of the things I tend to do with my long COVID patients is I'd like to put them on low-dose naltrexone. And there are actually some studies being conducted now looking at that as a possibility. We know LDN helps in fibromyalgia, chronic fatigue. Sometimes it helps in chronic Lyme disease. And so there are some studies being done looking at using it in long COVID to try to regulate the immune system to get it to stop being so inflamed, okay? The other thing that we know that I have found helpful is always put people on glutathione and always put people on curcumin and quercetin. There seems to be some benefit from that. One of the other theories about what long COVID is that having had the COVID, you wind up developing what are known as senescent cells, kind of dead cells that the body's not getting rid of. And these senescent cells basically get in the way of healthy mitochondria function. Okay. And so there's researchers looking at what to do about that. It's hard to say what to do about that. The one thing I do think that with all people on COVID, there probably is a component of mitochondria dysfunction. And so for that, I like doing glutathione. I like getting them on something to promote repair of the mitochondrial membrane. And that's a product called ATP 360. 3 pills one time a day that I'll wind up using on that. Okay. So yeah, my general protocol for people with long COVID right now is low dose naltrexone, quercetin. I like to have them on glutathione as well too. If they've got symptoms of mast cell activation, as many do, I definitely want them on quercetin. As I said, I might even put them on some prescription regulators of that as well too. And then finally, could this be a chronic long-term infection? Maybe, but it's hard to say, and I don't know. I don't know. Yeah. All right. Good luck to you, Bartley. Hello, Dave. Let's see. What are your thoughts on Lyme patients having dental root canals? I've read a few articles that recommend Lyme patients not having this procedure. So first of all, if you got a tooth problem, you got to deal with it. Okay, so to save your tooth and deal with that root canal, sometimes it's okay to get a root canal, or to deal with the pulp and the nerve filaments. It's okay to do a root canal. There is a risk in getting root canals in that you develop an area at the bottom of the root canal that can be a place where bacteria and Lyme and other germs can hide. And then that becomes a source for why you're not getting well. So I think that's probably why people are saying not to do it. But I think I generally tell people, save your teeth, get the root canal done. If down the road it looks like you're having problems related to that root canal or not getting better, then it's possible you might want to pull the tooth out, or you might want to get ozone just injected into those pockets, because that could be useful just for those kind of infections. Okay. Those are my thoughts on that. Okay. All right. Good luck, Dave. Hello. I don't know whether it's a Lee or Lie, but hello. Let's see. What is your opinion on purchasing doxycycline online? Lots of sites come up when doing a Google search, very appealing to those of us who don't have a doc that is willing to prescribe. Here is one example of one such website that will ship doxy without a prescription. Canadian Pharmacy by doxycycline online. Happy Family Store. I don't know. So the problem, the one thing I can tell you when you get doxycycline from one of the regulated pharmacies here in the States is that you have some assurance you're getting a product that has the stuff in it. All right. The problem you have when you get from outside the States is it's not clear whether you're buying from a source that is regulated and you're not getting a fake product. Right. So I don't know. That's the thing. It would be something I would. If it were me, I would want to try to get some validation, whether they have studies that show their product is real or not. But I don't know whether to trust it or not. You may be getting fake product. All right. Good luck. Thank you. Hello, Mosby. Let's see. Which infection do you see causing problems specifically in the vertebrae, running in the neck and thoracic spine? Anaplasma, mycoplasma, Bartonella, Lyme, etc. What infections have the ability to school and move together into different areas? So when people have problems in their joints and it's wandering quality, I tend to think of Lyme. If people tend to have joint and muscle and tendon area pain that stays pretty much in the same areas, I tend to think of Bartonella or Lyme. It could be either one of those. Those are what I tend to think of. Okay. All right. Thanks, Mosby. Hello, Colleen. Let's see. I experience a lot of post-exertional fatigue. My energy tanks from doing the smallest of things, so I need to stop frequently to rest and regain energy. We've learned from your article about energy. A friend asks, what's the glitch in the ATP production process for this condition? I.e., what's stopping it from being created or regenerated properly? Could you explain the Krebs cycle? The more technical explanation, the better. Also, I wondered how to navigate my energy. There's very little warning that I'm about to go outside of my energy envelope till already I've gone past it. Do you have any tips on that? It's very difficult to know how much I can and cannot do before I suddenly bottom out. Thank you for all your help, Dr. Ross. All right. So Colleen, I'm not going to be able to give you a detailed explanation of the Krebs cycle, but just know that there is a chemical pathway of a bunch of reactions inside your energy factories called mitochondria, called the Krebs cycle. All right. And the Krebs cycle, one chemical is changed to another, to another, to another. And the end result of that process is you generate the fuel currency of the cell called ATP. Okay, and there's 36 ATP that are generated in the Krebs cycle, basically. All right. Now, for the Krebs cycle to work correctly, you need to get fat and sugar moved to the inside of the mitochondria. And one of the things that can happen when you've had chronic infection is the covering of the mitochondria can get injured. And it can get injured because in chronic infection, there's an overproduction of a lot of oxidizing agents. And those oxidizing agents can injure the covering of the mitochondria. And when it gets injured, you may have poor transport of fat to the inside of the mitochondria and even possibly the sugar. Secondly, a healthy covering is needed for a process where electrons are transferred within this energy generating pathways in the mitochondria. And if the covering of the mitochondria is injured, you don't have adequate electron transfer as well too, okay? And so what the ATP 360 that I talk about does, or other forms of phospholipid repair products, is that basically they have phospholipid fats in them that repair that covering, basically, okay? All right. All right, there you go. I don't think I gave you the detail you wanted, but I'm not going to go into the detail here. Anyhow, good luck to you. Excuse me. Good luck to you, Colleen. Hello, Elizabeth. Let's see. Hi, Dr. Ross. Thanks for all you do. My doctor told me not to take lumbrokinase for Lyme and BART if I am only taking herbs and not antibiotics. She said the germ load would be too high. What are your thoughts? Also, what are your thoughts on getting the flu shot? All right. So, the lumbrokinase, I don't agree with her comments on the germ load would be too high. I use lumbrokinase with equal results and in my patients on prescription antibiotics as they are on herbal antibiotics. I don't find a difference. On both of those groups, there's a group of people, whether on prescription antibiotics or on herbal antibiotics, that tend to react strongly, all right? And there are equal groups in either one of those prescribed prescription antibiotics or non-prescription antibiotics that have minimal reactions, all right? But because people can tend to have some strong reactions, which are Herxheimer reactions, I tend to start at 1 pill a day of either the Beluki product or the allergy research product. And then as they go through their Herxes and that limit decreases, then I'll start having people do 1 pill twice a day on that. Okay, let's see. And then the flu shot's tricky. This year it's really tricky. So this is a consideration that you should talk with your doctor about. Okay, I just want you to know I'm not your doctor. All right, I want to be very clear about that. I'm giving you guys ideas, but ultimately I don't know everything about you. Okay, but so here's the issue. When you get the flu shot, you're weighing out risk and benefits. Okay, you're weighing out risk of getting the flu shot versus the potential benefit of the flu shot. So this year, we're having a lot of flu. And it looks like it may be even worse than last year. What's interesting, though, is in South America, we usually whatever happens in South America occurs up here usually. So it starts down there and then works its way back up. They had a heavy flu season to begin with, but in the end, it wound up being a mild flu season, okay? But our flu season's looking worse up here. And so it's a pretty heavy flu season. So you have risk of getting flu this time, okay? And possibly getting bad flu. So on the one hand, you've got risk of getting bad flu, okay? All right. On the other hand, when when people with Lyme get the flu vaccine, we tend to see that their Lyme gets worse. Right? Not everyone, but quite a few people do. Now, the people that, but if you're on antibiotics or herbal antibiotics and you get the vaccine, I tend not to see as bad of declines, and the declines last maybe 1-2 months, basically. Okay, so it's not a permanent decline. All right. Now, one other factor to consider is on average, because they have to try to predict the flu vaccine based on what they think the strain of flu will be out this year. The flu vaccine only looking after the season and how effective flu vaccines were, in general, they're only 50% effective. Okay. So these are the factors for you to consider. So if you get the flu vaccine and you have Lyme, you might have a decline that could go on for 1 to 2 months. Okay. You might. Okay. And okay, so that's on the one hand. On the other hand, the flu vaccine only works about 50% of the time, but it's a bad flu season out there right now. So, I think it's a personal decision. You're going to have to make it for yourself. I personally got the flu vaccine this year, and I actually got my COVID bivalent booster as well, too. I did it because I'm getting in the gym again. I'm starting to be around a bunch of people that breathe heavy and put their spit out. So I wanted to be careful this year. But I don't have Lyme. So, those are things for you to consider. Okay. All right. Good luck to you, Elizabeth. Hi, Carter. Let's see. Do you know what could cause hair loss on lower legs, shins, but not everywhere else? Also affecting my diaphragm, making by breathing weak, like I'm always flexing my stomach. I don't know. I'm sorry, Carter. I'm not clear about that. Because I don't think of that as being like a tick-borne infection related condition. This is something you might want to talk to a dermatologist to see if they can take a look at that for you too. Okay. All right. Good luck. Hello, Lynn. Let's see. Hi, Dr. Ross. Does BPC 157 increase TH1? And how would you compare BPC 157 to KPV, particularly for mast cell activation and inflammation? Okay. So, so BPC 157, I talked about briefly earlier, is a peptide that's made in the stomach lining. It's thought its purpose in the stomach lining is to repair injury downstream in the intestines, and it can help with intestinal inflammation and intestinal function. Okay, all right. The other thing it's been found to help with is it can do tissue repair, like tendon, ligament, joint repair. It can help with neurologic repair. And so I like using it for that. It also has anti-inflammatory properties. It seems to help decrease some of the cytokines. And it probably does some modulation of the type of immune cells. So it can help decrease the immune cells that make up Th2, Th17, and which then can lead to more Th1, which are your cells that fight infections. Okay. So your Th1 is made up of T cells that attack viruses and Lyme. And I call that the offensive squad. Your defensive squad is your Th2 and Th17. Th2 would be your B white blood cells that make antibodies. Okay, so the defense are always ready to they're kind of circulating out there. Okay. It also has your mast cells in it that make histamines. It's got autoimmune system cells. Th17 would be white blood cells that sit right underneath your skin and your mucous membranes that will try to grab germs that break through the barriers, and they act even if they can't tell you which the germ is, basically, versus your Th1 knows what the germ is that it's fighting. Okay. There's another type of cell called a T regulatory cell that tries to balance the cells. So it's the parent array. It tries to balance the Th2, Th17 versus Th1. BPC 157 may have some effect on that. Okay. Now, so KPV, on the other hand, is a 3 amino acid peptide that is stronger at regulating mast cells and maybe a little bit stronger anti-inflammatory compared to the BPC 157. So it depends on what you're trying to treat. I mean, if your main problem is inflammation and mast cell activation, if you were my patient, I'd probably go more to the KPV. But if you have a lot of, and then BPC 157 also can help with some mast cell stabilization and can help with mitochondria function as well too, okay? So BPC 157 is your Swiss Army knife, okay? And versus the KPV is going to be targeted more for mast cell activation and inflammation regulation. All right. So it depends on what you're trying to do. If you've got a lot of tissue injuries, sore muscles, sore tendons, and you've got neuropathy, you might start with your BPC 157 first and see where you get. And then if you need to add KPV in on top of that. Okay. So it all depends on what your situation is. Okay. All right. Good luck, Lynn. Hello, Miriam. Let's see. I was in the ER on Saturday because I thought perhaps I was having a heart attack, even though the pain was consistent with my normal angina chest pain, or was inconsistent. My troponins were normal, but my CKMBs were very high. No one knows what caused that. Could it be a Lyme flare? I don't know. I haven't seen that occur. I don't know. So I would say it would not be a common thing, but with Lyme, anything goes. But also we have to be careful when odd things happen. It's not to put our Lyme blinders on to see every odd thing as being Lyme too. So I'd say I don't know. I haven't seen that happen before. Okay. All right. Good luck to you, Miriam. Hello, Mary. Hi, Dr. Ross. Thank you again for doing this webinar and for taking my question. You're welcome. I stopped Lyme treatment to treat yeast. I'm currently on diflucan and nystatin for the past 6 weeks. Recently, I did the mycotoxin test with real-time labs. I tested equivocal to gliotoxin, a slightly elevated trichocethine with, you're just barely above. I got it. Okay. I plan to start IV Rocephin for Lyme and eventually add Mepron and clarithromycin. What do you recommend for the mold and when should I treat it? Would you recommend treating the Lyme, mold, and yeast simultaneously? All right. So, to be honest with you, just based on the numbers you gave me here, I probably wouldn't treat the mold. I tend to treat more significant numbers than that. That's where I find the bang in this disorder. So I'm not, from what you've told me here, okay, and if you were my patient, I don't know that I would go after the mold. I think I would probably focus on the Lyme, the Babesia, and your yeast, and you could do all those at the same time, okay? All right. Good luck to you, Mary. Hello, Shayna. Let's see. Why does Lyme mess with the visual processing in the brain? So, Lyme infects your nervous system. So it can affect any part of the nervous system, including the visual processing centers of your brain. So, so that would be my response. So it's not why, it's just that it does. It actually can impact any area of the brain, okay? Any part of the nervous system, all right? Good luck to you. Hello, Ernest. Let's see. Hello, Dr. Ross. Thank you so much for all your help and work for the Lyme community. You're welcome. Let's see. In Germany, some doctors say they have pretty good results with a treatment they call PT, insulin potentiated therapy. This involves using insulin injections in combination with antibiotics or antimicrobial herbs. When they put the body in hypoglycemia using insulin, the cells in demand for sugar will automatically open and become more porous. which will allow the antibiotics or herbs to penetrate much deeper into the body. I would like to know your opinion on this approach. Some herbs also have the ability to greatly reduce blood sugar levels. It can be interesting to use these in high doses to have the same results. Okay, so honestly, I don't know. It's interesting. As many of you know, I'm in the process of completing a book, which is going to be called is called Hacking Lyme Disease: An Action Guide to Wellness. Okay, and so I'm in the final rounds of edits right now, and we'll probably be uploading to get a print of it, a print of it from my publisher so that I can review it one more time. And I bet I'm going to be releasing this in early January. Okay, that's where this seems to be going right now. So my cover is done. I'm just going through some final edits. But anyhow, as part of that, I wrote a dedication page. And one of my dedications it fits this perfectly. So I said something like, "Thank you to my patients." And you get, and then I said a few words around that. But then I also said thank you to my the participants in my Lyme disease webinars, because you have brought new ideas to me that have pushed me to go deeper in my Lyme disease treatments. Okay, so this is a newer idea. I've heard of it before, but I haven't spent enough time looking at it. I do know that I'm not sure if it works or not. So I'll just say that to begin with. I'd have to see some science on it, to be honest, if they have science. I tend not to be a doctor that does things if there isn't some science somewhere that says somebody's looked at it and says it works. Okay. So for instance, I don't do SOT therapy because there is no science supporting that one at all. And it has all the reasons, knowing how it works, that it should not work. Okay. But I'll take a look at it and see, and I'll see if I can come up with an opinion for you in the future. But this is one that I have not yet reviewed. So thank you for bringing it to my attention. The one thing I will tell you, though, is knowing how medical boards are at those of us treating Lyme and doing things that are off reservation. This is one that would probably raise a lot of red flags, because they would be saying, "What are you doing with insulin? Where's the science?" And to be honest, I bet there's not much there. So anyhow, I'll have to get back to you on it. Okay. All right. Thanks, Ernest. Hello, Sharon. Hi, Dr. Ross. I know you often refer to being, cured of Lyme eventually, but my understanding is that if you're not diagnosed within 6 months to a year, you become chronic. What is your take on this? Thanks so much. So, it's interesting. So part of the problem with Lyme disease is that ultimately the only way you know you're cured is if you knock every germ out of you. Okay. Right. And we don't have a way of testing germ load in this illness. I mean, our testing that most of us use are antibodies, which measures an immune reaction. That's your Western blot and immunoblots, or the ELISpot test that measures whether your T cells are reacting. There is a genetic test you can do called a PCR test that looks to see if you have the genetic material of the germ in you, but it misses Lyme if it's there 70% of the time. Okay, so that's not an adequate way to do it. So we have no real way of testing to see if you're done. We just don't have that test. So there was a pretty vibrant discussion in the ILAS discussion group, International Lyme Associated Disease Society discussion group, maybe over a year or so ago, where there was a discussion about how do we, how do we know when somebody's cured, or when do we think somebody is cured? Okay. And the general consensus became at 2 years after treatment, if you have not had a relapse, most Lyme doctors are not ever seeing those people back again. And probably those are your cured group. Okay. So it's more of an opinion based on what we see, but it seems that probably if you can go not have a relapse in your symptoms by 2 years after you stop antibiotics, probably you're done. And you don't have to worry about it again. Okay. Unless you get another tick bite or something. But yeah. Okay. All right. Good luck, Sharon. Hello, Douglas. Let's see, I'm on the Zhang protocol 1 week in. Very smart doctor. Thank you, Marty, for your work. What is your take on the issue of can you get rid of Lyme or just remission? Zhang says if you treat it correctly, you can get rid of it forever. Yeah, so that's what I was just saying. I think that a large number of people get rid of this thing. I really do. I think there also may be a group that basically we knock the germ load down enough that you cohabitate with the germ and your immune system just does a great job of keeping it under control, the same way we live with chronic Epstein-Barr virus infections in us, et cetera. So, it's possible. Either way is possible. I think there is a group that does get cured, though. Okay? All right. Thanks, Douglas. Let's see. Hi, Flavia. Let's see. Hi, Dr. Ross. Thank you for making this webinar. You're welcome. I appreciate that. Thank you. Hello, Shauna. Let's see. I was diagnosed with the double-dreaded multiple susceptible genetics of 11352B and 14552B. I have been sick with mold, SIRS, and neurological Lyme disease. Does it mean it will be harder for me to get better with those genetics? Not necessarily. I mean, look, the genetics just means you have a predisposition to the problem. How your genes interact with the environment, or we call that epigenetics, determines what your real outcome is going to be, okay? So having a bad roadmap or blueprint doesn't necessarily mean you're going to manifest the full difficulties of the problem. So I would say I've had people with this dreaded picture and they've gotten well and they do quite well. So it doesn't mean you have a more complicated illness when you're in the middle of it. Probably so. But it doesn't necessarily mean you're not going to get better either. Okay. All right. Good luck to you, Shauna. Hello, Gemma. Let's see how Dr. Ross. Probably a silly question, but curious. If you herx upon increasing or starting new antimicrobials, after the herx settles, is there still killing going on for the rest of the duration you're on the same tablets, which is usually a couple of months, or are you just keeping the infection at bay? It's difficult to distinguish between die-offs and flares. Okay, so herx is what happens when you get a cytokine storm, an increased level of cytokines, and it's related to a surge in cytokines from killing germs, okay? And that usually has the greatest chance of happening right as you change antibiotics, increase the doses on antibiotics, all right? All right, now, that's not to be confused with the normal ups and downs that these illnesses cause. These illnesses cause periods where the cytokines will go up and down. But when that cytokine flare, the worsening flare, occurs near the beginning of something new or a changed dose, that's a Herxheimer reaction. Okay? All right. And, to answer your question, are you still killing? Yeah, you're still killing germs. You're just not having, your immune system is not responding as fully as you get the germ load knocked down, basically. Okay? All right. Thanks, Gemma. Let's see. Hi, Lee or Lai. Let's see. What is the name of the place you mentioned a while back that has homeopathic treatments for Lyme? I can't remember what that was. Hello, Taze. Hello, Dr. Ross. I have an autoimmune disease in Lyme. Someone who has Lyme disease and who needs to use an immunosuppressant, how should this be done? Along with the antibiotics, after antibiotics, could the immunosuppressant, by lowering immunity, favor the activation of Lyme and co-infections? I'm really confused about this because doctors who prescribe immunosuppressants know little about Lyme disease, and I think my Lyme is still active. please, if you can, comment about it. Okay, so not all immunosuppressants are equal. Okay, so the one that has the most devastating consequences for Lyme would be steroids. Okay, and talking about being on non-physiologic doses of steroids. So for instance, some of us may be on low levels of hydrocortisone, also called Cortef. And when we use that, we're using it to replace what the adrenal glands should be making because they're not making it, okay? So you need a little bit of hydrocortisone steroid in you for your body to work right, your immune system to work right, okay? But when you start getting like prednisone pills or IV steroids, those are very immunosuppressant, and I don't like my Lyme patients being on those, okay? All right. The rituximab, all these newer ones, I have a hard time saying that, but rituximab, that's it, rituximab, basically is more of a targeted immunosuppressant and is not going to have the terrible consequences on the immune system's ability to fight Lyme. When I generally see people on one of these newer immunosuppressants that are not prednisone, I will have them stay on them until the antibiotics that I put them on, or herbal antibiotics I put them on, and all the other things I do in my treatment protocols start to turn them around. And then I will start pulling back on some of their immunosuppressants. Keep in mind, and the reason that is that sometimes their autoimmune illness is actually being triggered by Lyme and co-infections. And as you get those under control, you may not need to be on the immunosuppressants, okay? The other thing I like doing in situations with autoimmune disease especially is I like to get people on low-dose naltrexone because that also modulates, it helps raise T regulatory cells that can then control the amount of Th1 and the autoimmune reactivity of Th2, Th17. It can balance that out so you're not needing as much of your rituximab and you have better symptoms as well too. Okay? All right. Good luck to you. Thanks for the question. Hello, Mary. Let's see how Dr. Ross. Thank you again for doing this webinar and for taking my question. I stopped Lyme treatment to treat yeast. I'm currently on diflucan and nystatin for the past 6 weeks. Recently, I did the mycotoxin with real-time labs. I tested equivocal. Oh, wait a minute. I read this one earlier. We did this one earlier. Sorry about that, Mary. Hello, Esther. Hi, Dr. Ross. After 8 months of antibiotics, I can no longer tolerate them. Symptoms came back after just 3 weeks. Oh, we already asked that one earlier. Oh, maybe I didn't answer this one earlier. Let's see here. I can no longer tolerate them. Symptoms came back after just 3 weeks, so I started your BART protocol. The herbs are really strong. To start fairly slowly, how much cinnamon, clove, oregano, Hutania, and Sida acuta should I take? I have been herxing like crazy and been feeling very unwell. I had been increased by 1 drop each day and 1/4 teaspoon of Sida acuta. Should I be concerned? I am no longer being treated for Lyme and just BART. Also, how long does it take to feel the effects from BPC 157? Okay, so the cinnamon. So regarding your question, cinnamon, clove, oregano treats growing and persister Lyme. Okay, and it's also treating growing and persister Bartonella. Sida acuta can treat Lyme too. Okay, so you've got some coverage going on here for the Lyme infection as well. And what I would do if you're herxing badly, you might want to drop the cinnamon, clove, oregano back to 1 pill a day from 1 pill twice a day if that's what you're doing. And if you're really herxing bad, obviously do your, regulate your cytokines. You should be on curcumin, 500 milligrams 3 times a day, or at least that's what I recommend to my patients when they have increased cytokines. You're not a patient of mine, but what I recommend to people in my practice that have increased cytokines is curcumin, 500 milligrams 3 times a day. I like using the Thorn product for that. And if it's really bad, then I'll go ahead and increase it up to 1,000 milligrams 3 times a day. I also, when people have severe herxes, I'm going to want to get them on glutathione, that Trifortify product I mentioned earlier from Research Nutritionals, and I would do a teaspoon once or twice a day of that, okay? And if it's been going on for a while, I might start cutting back on the intensity of the treatment. And again, one place to do that would be to drop from 1 pill twice a day down to 1 pill a day of the cinnamon, clove, oregano. Okay. And then BPC 157, I usually see benefits within the first month or two. If I don't, I stop after 2 months. Okay. All right. Thanks for that question. Good luck to you. All right, everyone. I'm cutting out 10 minutes early tonight because I have some plans with some friends later that I got to get to. It's been good being with you here for the hour and 20 minutes, though. I'm sorry to cut back 10 minutes early, but that was the way I can navigate everything tonight. And I've got to get my dogs out before I can go visit with my friends. So anyhow, so keep your eyes out tomorrow morning, somewhere between 9 to 9:30. I should have the recording edited and out to you. At least that's what my game plan is. And then I also have a chance to sign up for next week's webinar as well, too. All right. So I've had a good time being with you all here tonight, and I hope to see you all next week. And good luck with your pre-holiday shopping ahead. All right. Good night, everyone.